I've gotten to this point of saying, like, look, if you tolerate that food and that feels all right, then that's all right. If you tolerate that food and it gives you horrible gas and bloat or whatever, then your immune system's telling you something and you might need to lay off that food until we can get this immune system into a better place so that it can tolerate it again. So it's always the until we can.
Hey everyone, had a great conversation today with nutritionist Heidi Turner. We did a deep dive into enzymes, and I really appreciated how much she drills down into understanding the person and what enzymes they may need. And this sort of permeates beyond enzymes. Really, technically, bile is something we spent a lot of time on, and bile helps with fat digestion. And Heidi is seeing a lot of people who have congestion or sluggish bile release. So we talked about bile, fat digestion, lipase, and ways to think about either giving those enzymes and or bile, or ways to help restore and facilitate bile release, which can actually be anti-SIBO, anti-constipation, and help with detoxification. We also discussed HCL and how and when and at what dose to use it. We talked about the DAO enzyme for histamine. We discussed fiber and fiber digesting enzymes and brush border enzymes. And again, I really appreciate about Heidi how much time she spends here. So there was many clinical pearls that she shared. Also, her perspective on how gut function influences diet, and the perspective on diet should not be one of long-term strict avoidance, but rather using some of these enzyme tools, amongst others, to improve food tolerance. So lots of pearls on the enzymes themselves, but also a very, I think, empowering and correct perspective on how to use diets as short-term tools to heal so that then your food tolerance improves. Heidi is wonderful, and I hope you enjoy the conversation as much as I did. Heidi Turner, welcome back to the show. I'm super excited to talk about how we handle diet responsibly. And I was just saying, I love your perspective on this. So super excited to be chatting again.
Yeah, Michael Ruscio, thanks for having me back.
Of course, of course.
Great. Yeah.
Gosh, there's so much here to unpack because when people aren't feeling well, I think the people in our audience, they're well informed and well read enough to appreciate the impact of food. Yes, such a massive win. Like people getting that there's something beyond just using a medication to quell your symptoms. And sure, there's a time and a place for that. But again, I think we serve these people who are looking for something more causative, more natural, and dietary and lifestyle based. So all this, yay, right? We're same page. But I think we also see people who they go too far in that direction, or maybe like I was saying to you before we started the recording, I saw someone who every other before us doctor or nutritionist she saw had a very alarmist perspective about her diet, her gut, her lab tests. And this is where I think we do unintentional harm. And I know I'm kind of preaching to the choir here, but just to maybe set the stage for people listening to this, there's so much we can do to improve health by using diet correctly, but oftentimes the tool is over-leveraged. People fall into overly avoidant dietary patterns. And so what I'm hoping we can do today is kind of talk through what are the big components of different dietary approaches to try, and what's the approach that we look at diet regarding in terms of, I know you have a similar frame on this and I want to give it over to you in a second. So sorry for the long preamble here, but I kind of think about it as a rehab diet. This is going to be a temporary program with the expectation that you're going to heal, your tolerance will improve, and you're not going to be labeled as I'm a histamine intolerant person, I'm a SIBO low FODMAP person. Just like the person who injured their back isn't going to be walking around 5 years later saying, I'm a low back sprain strain person, so I can't do X, Y. I mean, sure, maybe they have a few things that they're a little bit careful about, but they're not going to have this identity shift to a person who is, X, Y, Z.
Yeah, absolutely. Yeah, and I that is so important. I think that, when people come to me, so I specialize in food intolerances, food sensitivities, things like that. And I also, especially situations where people have found that they've had to really restrict the diet and they have a hard time expanding things out. So that's an area that I spend a lot of time as well. So, but a lot of people come to me and say, hey, I've been diagnosed with histamine intolerance or FODMAP sensitivity or sulfur intolerance or whatever. And there's this taking on as diagnosis. And, and that, like, I get that, right? I get it. It's like you feel horrible. You don't know why. You have horrible gut symptoms. You can't sleep. You're anxious, whatever, all these kind of symptoms that you might be experiencing. And then you make a change to your diet. Let's say you take histamines out of the diet, right? So you take that out. And all of a sudden, you feel so much better. And maybe your practitioner told you to do it, or maybe you just learned about it online or whatever, but you feel so much better. So there's that causative, like, I feel horrible. I take these foods out. I feel better. I must have that thing. And therefore, and yet, and therefore, I am diagnosed with this. And yet, this is a horrible diet for me to follow for more than like a couple of weeks or a couple of months. And oh my God, what do I do? And so, I think that, as you've already stated, that, we really have to think about, like, wait, I really try to stress to everybody, this is not a diagnosis. Okay. This is a condition. This is a symptom of a larger situation that you are experiencing, of a larger immune dysregulation, typically involving your gut. It can involve other parts of the body as well. But that this is a very reversible situation. And I think that that's really important. Like, that's one of the first things that I drive home to people, so that they can start to go, oh, okay. Let's like chill out about it a little bit. And I think it's important, to your point too, of like the practitioner kind of, driving this home of like, you have this condition and you have to stay off of all of these foods. That's not necessarily the case. Like, you could have, I'm going to keep coming to histamine intolerance because it's a pretty popular thing at this point, FODMAPs as well. You could have a histamine intolerance and, and feel better on that diet, but still have a certain level of ability to bring a lot of those foods in without any kind of reaction. And I think it's really important too to kind of find, what is that balance for you? Does histamine, is a low histamine diet working for you? Is it the correct diet for you? And if it is there some level of expansion that you can find within that? And so these are the things that I'm always kind of working with, trying to kind of dispel the freak out aspect of it, and also try to kind of like help you work with it. And then also, what's the underlying thing that's really driving that situation?
And by the way, if this has been helpful, please comment and subscribe. This really does help us reach more people who are trying to improve their health. So it is quite deeply appreciated. Yep, very well said. And I'll just sort of second this perspective that the diets are, in my view, tools to help you get a sense of fine tuning, but not something that you have to follow 100% and very sort of staunchly. And this, gosh, just no matter how many times I say it, people need to keep hearing it again and again. And I think we've maybe both had personal experience where maybe I can say for myself, low histamine has been helpful, but it's not something where I'll never have an avocado. In fact, I tend to eat a little bit lower histamine, but I eat histamine. I just don't eat high histamine. And I've learned that if I have at every meal a couple servings of high histamine foods, after a number of days, I start to manifest some of the symptoms of histamine overload. But there's a really big difference between eating high histamine at every meal and saying, okay, I'm going to have an avocado with my eggs for breakfast, but I'm not going to have an avocado with my eggs and have, let's say, kombucha, and then at lunch have a salad with a ton of beet kraut and canned fish, and then at dinner have, insert high histamine. So
yeah, exactly.
And I think people have a really hard time, to your point, because maybe they do go, again, low histamine, let's say, as one example, they feel better and they assume, oh, I've just got to double down on that. And what can happen is they say, oh, look at all these foods on the high histamine list. I can never eat those again. And couldn't express how far from the truth that is. Just like you're saying, it's just figure. And with FODMAPs, with anything else, even with carbs, with someone who doesn't do well with Candida, you can have who doesn't do well with starches because of Candida. You can have some starches. You just can't be doing a big thing of white rice at every meal. And again, the difference between absolute avoidance and some is so freeing in terms of, it's livable to have some and just look at this as a way to fine tune your diet.
Absolutely. I have people who have been told by practitioners that, and I'm not throwing shade at practitioners because we're all well intentioned, right? We all want to see the person get better, right? But I've had some situations where, like, let's say in a Candida diet, that they have, they've been following low sugar and no starch and, really no fruit and really, really low. And maybe they went out and had some, candy or had a, high carbohydrate meal, and they're being told that you're never going to get better if you stray from that. You have to go back completely into this food prison. And I can't, what I also talk about is like, well, wait a minute, what's more damaging, to us to feel, be locked in that prison, or to, be able to feel like I can kind of exist in this world and have some starch or have a little candy or have something like that here and there. Obviously not at every meal, as you're saying, not in huge concentrations, but like to feel like I can exist in this world, because these treatments that we're talking about take a long time. These aren't just like 2-week things. Sometimes they take months or years to really kind of, regulate. So if we're kind of locked in this place, what's more damaging psychologically? Or, we have to kind of still exist and still give ourselves that permission. And I think the other aspect here is you got to listen to what your body is telling you.
Yes.
Because let's say, a low histamine diet or a low starch diet or whatever is, really beneficial to you, but you can eat those things and it feels okay. And the body is saying like, yeah, you can do that. No, you can have that. That's all right. Then it's like, you have to listen to that, because we have these huge things of lists that are like, well, that entire list may not apply to you specifically. Maybe only some of those foods apply to you, but but we have to kind of think about what really works for you. And so that's a really important aspect as well. I am very much, and I've gotten to this point of saying like, look, if you tolerate that food and that feels all right, then that's all right. If you tolerate that food and it gives you horrible gas and bloat or whatever, then your immune system's telling you something, and you might need to lay off that food until we can get this immune system into a better place so that it can tolerate it again. So it's always the until we can. So it's really finding your own place within these diets. I think it's so important.
And like we say in the clinic, your body is boss, right? And that's meant to imply that you listen to your response. And the other thing I would tie in with that is, especially if someone's done comprehensive testing, there might be a number of what I would term red herrings. And again, I don't mean to be beating this drum here for our podcast audience. I know they've probably heard me say this so many times, but so many of the GI tests are speculative. Well, we did a stool test, a urine test, a blood test, and this is suggesting that you have oxalate sensitivity, histamine sensitivity, FODMAP sensitivity, Candida, and then that person thinks they have to follow all of those diet lists completely. And this is where we run into the problem. If we don't juxtapose all those experiments, like, yes, maybe you try low FODMAP for a week or two and assess, and then low histamine, and you take what seems to work and you leave everything else. But if we don't do that, if it's, well, the lab tests came down from on high, and so therefore I have to follow all of the prescriptive recommendations based upon those labs, we end up firstly thinking that we're worse off than we are. Secondly, under eating. And this does manifest as anxiety, depression, a feel of being encumbered and chronically stressed because you're always worried, nutrient deficiencies in some cases, and then under eating in others. So, yeah, I mean, again, I feel like we've had this conversation on the show so many times, but I think it just really requires repeating, because it's not, in my view, it's not emphasized enough in the conversation. And maybe it's just how people come across things, right? They come across a little snippet and they weave all those together, but they're not getting like a longer form conversation where we can really expand upon not just the foods to avoid, but the larger perspective in which we look at this.
Yeah, or I mean, who knows where we're getting our information from, right? So it's we have a lot of access to a lot of information, and when we're not feeling well, we go looking for it. And if our doctors, if we kind of think from a Western allopathic perspective, they're not going to really be hip to all of this. Finally, we've got some FODMAP followers, when they do or histamine maybe, but if you're not getting the information, you might kind of go like, oh, histamines, yeah, that really aligns with some of my symptoms. And oh yeah, FODMAPs, that really aligns with some of my symptoms too. And yeah, I have urinary tract issues, so maybe the oxalates. And so all of a sudden you can kind of see in this building. So even if you don't have those tests kind of saying like, yeah, you got oxalate issues and you've got, SIBO, so you need to go on the FODMAP diet. And, even if you don't have all of that, you can kind of collect all of these things over time and then end up eating chicken and rice or chicken and blueberries or whatever. We'll end up with those two foods, which are pretty, and then not know where to go because you're so terrified of moving into each of those directions because maybe that person or that influencer or whatever really says like everybody needs to go on this diet and that person says everybody needs to go on this diet. We just get so lost within it. And so back to this whole idea, and we're saying kind of same thing is, if you're a practitioner and you are layering diet after diet after diet, careful what you're saying one thing at a time. Let's just make sure, because maybe the high oxalates in that organic acid test don't really add up to dietary problems with oxalates. Maybe there's some mold issues or some candida issues or whatever going on. Maybe that doesn't really make a difference. Maybe just the fact that you have mast cell activation syndrome, that doesn't necessarily mean a low histamine diet is going to actually work for you. So that diagnosis, or these labs don't necessarily add up to a food intolerance for you specifically. So that can be helpful, nice guides into that, but you have to try each of these things on separately. And a lot of the times I'll say that I will get people who have just taken them all out because of all of these things. And so what we'd have to kind of do is then backtrack and go, and all I'll have to do is assess and go like, okay, what's the most, based on what you're telling me that you experience, what are the most likely ways for us to kind of move out? Well, I don't know if this is an oxalate thing. Let's start moving into that direction and start building more of those foods in. Maybe it's not so much of a, like how can we start to kind of rebuild from there? So the whole point is how do we not get to that place? But if we do get to that place, okay, that's all right. That's all right. But there's a way out. And it doesn't mean that you have to stay just in your food prison. I like to call it. There's ways to come out of that, and that's not to say, because I know that there is a whole subset of people, and I want to make sure that we're kind of acknowledging them, that there are people where it's all of it. There are people where it's like they've gotten down to a few foods and they can't get out of it. They've tried bringing foods back in. They've tried expanding out the diet and they just can't without a severe immune reactivity. And I work with a lot of those people. I have people on TPN and people on tube feeding, and not that I've put them on, but that's just the case. I have people on one food. I have people on two foods where you just are like, can't get past it. And, we're working with a severe immune dysregulation at that point.
Yep.
Right. So we really are. And no food is like the best kind of, case scenario for them specifically. So that's kind of on the other end of the spectrum. I think we're also, so we're kind of talking from a general perspective. We also have to kind of think about all the different presentations that are out there these days.
Absolutely.
And
those people who are really reactive, and I know we agree on this, there's almost for certain something else that's driving that degree of food reactivity. So the pathway to expanding their diet is not necessarily dieting harder. They may have to be on a very, as you're saying, restrictive plan for a short term, which is why it's so important we look for the other causative factors, which I want to outline here in a second. And we'll break down some of the categories of food intolerances, and then I'd love to work through how you address those. One thing I want to say, maybe I don't want to throw sand at people. I'm not going to mention anyone by name, but in case this helps anyone, I was having a conversation with a friend of mine, and he was having a conversation with a fairly well-known influencer in the healthcare space, a doctor who's well-known. And he said, "Hey, some of the therapeutics that you and I have been talking about, I'm trying to get this other doctor on board with and to experiment with. And I know you, Michael, have had some nice results with those clinically. Would you mind talking with this person just to sort of share your experience?" This is via text message. And I said, I've interacted with that person in the past, and they come off kind of arrogant, if I'm being honest. And the interesting thing I connected was this person has a very arrogant way about them, but their dietary recommendations are all super dire and super strict. And I think the problem there, and the thing I'm trying to point out here is people who are overly confident or arrogant usually don't have the requisite humility to understand when they're wrong, when they're over restricting people. And I think they fall into a syndrome of it's got to be this way. And if it doesn't work for you, you're the problem, not the diet. And I think as an attentive clinician, if you make a recommendation and it doesn't work in keeping with your body as boss, now we modify the plan. We don't tell you or chastise you and say, well, double down on gluten-free. What do you mean it doesn't work? You've got Hashimoto's or whatever it is. We've got to be humble and really listen to the person. So for the audience, just take note about that. And I've said this so many times in the past, but again, it's one of these many things that I feel bears repeating. If people have very confident, very assured perspectives, at least in my view, oftentimes that's emblematic of them not listening to people. And it's kind of like my way or the highway.
Absolutely. Oh my gosh. I cannot. Yeah. Yes, 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 and yes.
Yeah. So let's discuss some of the walls of said prison, so to speak. There's non-celiac gluten sensitive. There's FODMAP intolerance. There's lactose intolerance, fructose intolerance, histamine intolerance, and maybe even starchy carb and sugar, malabsorption or intolerance due to, let's say, candida. One of the things I've been thinking about progressively over time is so many of these, amongst other things, can come down to a lack of the intestinal tract to produce adequate enzymes or metabolize foodstuffs. I mean, FODMAP intolerance, that's been shown to improve with low FODMAP dieting. Histamine intolerance, as the gut heals, it has been demonstrated that DAO enzyme that metabolizes histamine improves, comes back online as the intestinal tract heals. Same thing with lactose intolerance. So I think the real ray of hope here is so many of these food intolerances don't seem to be static, fixed, and forever, but rather, like you were saying before, are downstream to some sort of intestinal damage, inflammation, microbiota imbalance upstream.
Yeah, absolutely. So many things that, I can think of. I'll start with the enzyme aspect of things, because I would say this is probably the thing where I start with most people who are coming to me with all of these food intolerances. And, it's I'll ask people, A, are they taking digestive enzymes? And then B, or have they in the past, if I see that they haven't. And, digestive enzymes, there's a lot of different types of digestive enzymes on the market. There are ones that have hydrochloric acid in there. There are ones that just kind of work with pancreatic enzymes. There are ones that have bile acids in there. There are ones that have different enzymes that help us to break down fibers. There's lots of different types of enzymes that are on the market. And so if one person has tried one enzyme, but maybe it was just, it didn't have any hydrochloric acid in there and you needed the hydrochloric acid, or maybe it didn't have any fiber digestive enzymes and you needed those fiber digestive enzymes in order to help you to break the food down effectively, we have to really figure out what it is back to the individuality. What does your body need? Where is the hitch in the get along in terms of your body's ability to break that food down? Now, not everybody needs enzymes. Not everybody needs that level of support. So I'll just start there. But most of my clients do. And I've had situations where I work with a lot of mast cell activation syndrome, where just those mast cells are just going off in the gut all the time. And that's kind of what's feeding into the, reactivity that they're experiencing. And just by giving some level of digestive enzyme to them, it calms that mast cell activation. It calms the histamine release. Because now, let's say you weren't digesting or able to break down those fibers, and we have the appropriate enzyme in there for you to help you break those fibers down. We're getting less undigested food in the gut. We're getting less fermentation overall. We're just getting less agitation overall. We're actually able to kind of utilize what we're getting. So, think about, so I've had situations where somebody has severe, let's say, diarrhea, and they just have not been able to get on top of it. And then I see that, oh, wait a minute. The diarrhea really started, after you had a cholecystectomy, after we took out the gallbladder. Okay. So that really, okay, that's obvious, right? And so they've, tried all sorts of different things that the doctor has prescribed, and nothing, cholestyramine and things like that, nothing's really helped. And I said, well, listen, have you tried any kind of like fat digesting enzymes like lipase or bile acids or things like that? And well, no, I've taken a digestive enzyme, but when I look at the enzyme, there's only a few hundred units of lipase in there. So just by bringing in additional lipase, just by bringing in some level of bile acid to help, we start to see that they can then, help themselves digest that fat. And look, all of a sudden we don't have the diarrhea anymore. And, I'm kind of using that. That's a little more obvious because they just had the cholecystectomy, but I will assess that in all of my clients, right? So, I'll listen to like, what foods actually feel more problematic to you? The starches, the fats? Is it the proteins? Is it the fibers? Is it the vegetables? And they'll usually have a sense of like, yeah, I cannot do protein. It just sits in my gut. I cannot do any kind of vegetable. It just agitates. That gives me a sense of where we might want to kind of dial into specific enzymes coming through. Maybe we just target the fibers. Because I also say is that if you give yourself, say, pancreatic enzymes, but that's not the problem, right? You are producing adequate amounts of amylase and lipase and protease, and you're bringing those things in. Putting more enzymes in there, it often doesn't feel very good. We see more cramp, we might see more bloat, we might see more agitation or burning, right? Because the pancreas is like, I got it, man. I can take care of this, no problem. Why are you giving me more? And so if we see that when we're giving someone an enzyme and they're getting worse, then it's like, okay, let's pull back on that. But maybe we need to be kind of thinking and again, back to listening to the individual. Where might you need additional support for fats, for proteins, for enzymes that brush border enzymes? Lots of different enzymes, lots of different acids, lots of different things being produced in that gut, that maybe there are more individual things we need to be thinking about.
So let's chunk these, try to give people some specific presentations along with what they should take. You had mentioned first in that list, fat malabsorption. So you notice you eat too much fat, maybe you're bloated, maybe you have loose bowels, maybe you have sort of greasy stools that tend to float. So you're thinking here, lipase and bile. Are you doing these together? Is there a formula you like? What do you do here?
So if that were the case, I might start with lipase specifically. And you can get just straight lipase. You can get ones that are smaller amounts of lipase, and you can get ones that are larger amounts of lipase. So I might just start with the lipase specifically, depending upon the sensitivity of the client. If I see that they're really, they don't have good food tolerance, or they taking enzymes or taking any kind of supplement really freaks them out because they're so reactive. This is big in my world, right? I might start with like smaller hundreds, and just kind of see like, A, do you tolerate this? First, always the question, do you tolerate it? And then B, does it do anything for you? And if there's some indication that there's some benefit to it, then okay, can we take another one and see? And then maybe we're seeing that, yeah, the more I do that, it's helpful, but I still need more help. Well, let's maybe go to the larger formula and build that in and see how that works. And then if that's only getting us so far, but we do feel like the fats
Sorry,
are
Heidi,
the more
not interrupt you.
problematic
Just
thing.
one quick clarification there. When you say larger formula, do you mean lipase plus bile, or what does that larger
No,
formula
maybe
look
just
like?
more lipase.
A higher dose. Okay,
Yeah, I
gotcha.
use one. Yeah, just higher dose lipase, basically. So I have ones that are lower dose lipase and ones that are higher dose lipase. So I might just kind of, veer into those, just depending upon how they're doing. Then I might consider bile acids are kind of strange. Not a lot of my clients tolerate them very well, even if they might actually need them. They may not tolerate them very well, and so I'm a little judicious with those. But if I kind of see that might be beneficial, I might add those in. And usually, again, start at very small doses, 125 milligrams. Just kind of come in and see how that goes. Now, I'll just kind of maybe move into this whole other aspect of things, and we can come back to the enzyme piece because we are on fats. Is that I do see a fair amount of bile acid insufficiency and bile congestion in my clients with food intolerance that really can feed into not just fat malabsorption, but dysmotility, constipation, from excessive fermentation, things like that. So I will also just kind of try and see, not just giving bile acids, but can we kind of open up massage those bile ducts a little bit more so that maybe you can, empty out more bile acids. And we can do that with digestive bitters. We can do that with castor oil packs. We can do that with chanca piedra, tudka. We can use different things that could help to kind of open those up and see if that doesn't actually help with more of your own ability to digest your fats. That's what I like about things like bitters and that type of ideas. What can we do to get your own system back online so
Sure.
that it can digest
Have
itself?
you have you used LVGB? That's a product by Designs for Health. It's got I think fenugreek, dandelion. It's sort of like bile thinners and things to help silymarin's in there too.
Yeah, not specifically, but yes.
But
Yeah, I
that
mean, not
sort of
that not
thing.
that project
Yeah.
specifically, but
Yep.
yeah, that type of thing. I work with bile thinning. I just got to step aside for a second and say, like, working your bile ducts from my perspective. And once I learned this, maybe a few years ago in my practice, this has really become a really key area for me. I work this angle a lot because I feel like there's a lot of people that are not detoxifying well because of congested bile ducts and who are not eliminating well because of congested bile ducts. And those things can really kind of feed into the dysbiosis that we're looking to clear, things like SIBO, things like that, or the detoxification of molds or whatever else we're taking in through our environment. And so, if we're not tolerating treatments or we're not tolerating our food or things, there's a significant dysmotility where we either can't move our gut or there's too much gut movement. I assess those every single time. So enzymes and assessing bile ducts for me become a really key piece in terms of trying to kind of help you tolerate your food and help that gut move.
And when you say assessing bile ducts, how are you doing that?
And basically, I kind of poke them with
Okay.
with either a different that could be like the formula you talked about. Um, Depends upon the person. So if it's a very sensitive person and we're not going to give them anything orally because we want to kind of back off a little bit, I might say do some abdominal hydrotherapy over the liver, hot, cold, hot, cold, hot, cold, back and forth. Sometimes that can kind of release. I might do castor oil packs and see if that doesn't help, a nice cholinergic. I might give some digestive bitters, and I try to keep it one single ingredient, no alcohol, something very easy, see if that stimulates some things. That might be our first kind of thing for someone who's super, super, super sensitive. If they're feel like I got a little bit of, I can maybe get in there a little bit more. I use a lot of stonebreaker, a lot of chanca piedra. It's an herb that basically can help to break up any kind of microstones, and that can be applied to kidney stones or gallstones. And so I use a lot of that. You gotta be careful of that stuff. So you gotta go super slowly because, and I've learned this the hard way. You gotta go really slowly with that stuff because it works.
And do
And
you
if there
notice
are
is
any kind of
diarrhea, is that a common thing that you'll notice if you go too
cramping,
aggressive?
like
Cramping.
liver
Okay.
cramping,
Okay.
and then yes, looseness of the stool. So I'll come back to that. But like if we start putting something in there that's really working on any kind of like stone formation in those bile ducts, it's going to hurt. It's going to be a little agitated and crampy. So you got to go in really slowly with that. and then build as you are able up to the recommended dosage, because dosages are usually like, take 2 capsules of this twice per day. And it's like, don't take 2 capsules of this twice per day. Like, take a quarter of a capsule in a little water, and we'll start there. So the bile ducts, I think, are incredibly important in terms of really helping things to move considerably. What I will say is that if you do take something like that, like Chancropiedra or Tudka or any of those sort of bile thinners, be careful. If you are managing your constipation with things like magnesium or triphala or things like that, right? If you're using a lot of those things to have a bowel movement, but part of why you can't have a bowel movement is because your bile ducts are congested. Once you start opening those up, to your point, yeah, diarrhea is going to happen, in which
Oh,
case you
and
got to
sorry,
pull back on
yeah, to
all the other
clarify,
things.
and just to clarify for people, bile is kind of a laxative, in a good way, right? So that's how this connects in terms of if you need something like Motilpro, ginger, magnesium, vitamin C, then you start mobilizing more bile. It might not actually be that you're having a negative reaction to the bile thinners or flowing agents. It could be you need less magnesium or vitamin. And that's a key thing. It's that what we would hate to have happen is someone thinks, ooh, it gave me diarrhea, bad, I'm going to stop. So just to keep your feelers out for that, guys.
Yeah, because we want to assess that. Like when I'm assessing somebody to start and I might ask them, do you have constipation? And they say no. And then I look and I see that they're on 3 different prokinetics and magnesium and vitamin C. And I go, well, wait a minute, what happens if we take that away? Oh yeah, no, I've got constipation. And it's like, okay, you're managing, better to have the bowel movement. Like you've got to keep that flowing. Nothing against those things, but if really the issue is that the bile acids are not being secreted, then yeah, you can lift those things out, and let's get to the core of what's going on and use those things that help that bile flow. That's what we're
Sure.
looking for. Yeah.
What
Yeah.
about something like modified citrus pectin that would be a binder? I see a case for that in some people, but what's your experience been? Have you tinkered much with that at all?
A little bit, just in terms of like from a binding effect and detox effect.
Yeah, if you bind, the theory here, well, taking a step back, modified citrus pectin has been shown to be pretty helpful for constipation. It's also a detox agent because it binds, but as it binds the bile, the body senses that bile is being bound to and excreted, so it starts releasing more. So that, I wonder, where do you see that fitting in? Or maybe it's not something that's a go-to for you with this
It's not a
picture.
go-to for it's yeah, thank you. It's not a go-to for me, though I have used it in the past, not for that specifically, but it's not a go-to for me. And the only reason it's not, because I love everything about it, is tolerance in my population. There's something about the citrus pectin for my histamine people or for my mast cell people. For some reason, I haven't in clinically seen tolerance. And so typically when there's so many things to use, right? So we've got this whole toolkit of like 300 things we could potentially throw at someone. So if I am trying something like citrus pectin or what a DAO even, right? If I'm trying something and I'm just not getting the feedback, or I'm not getting the tolerance that I am like comfortable with, because it's expensive. I'm going to ask you to Pectosols and things like that. They can be pretty expensive. So I'm going to ask you to spend $60 or $70 on something that I'm seeing a lot of reactivity to. Probably not. I'm going to probably be, hey, the Chancropiedra is $18, and that's where I really see good, stuff happening. We can work with other kind of, binders and things like that, especially if we're, detoxing mold or metals or whatever. Like we can work that a little bit later in, but perhaps that's why I haven't really gone too far down that road
Sure.
or many other roads.
Right. Right. No, super helpful. Okay, so this is the fat and bile piece. I do want to come to HCL, but anything before we transition? Anything else in
No,
the
I
fat?
think
Okay.
that I just it's a big piece for me, that I feel like I will assess every single person's bile ducts that I meet with. And like it's to the point, like it's so important for me, and I feel like it is such an important aspect of our ability to detoxify and digest appropriately. And if you're having issues with chronic SIBO or chronic SIFO or all of these kind of things that you're throwing everything at it and nothing's working, assess those bile ducts. Like, I cannot tell you enough, because so many times I'm able to, if we can get those going, we're in such a better place, and you're going to be in a much better position to actually treat the SIBO you're looking to treat.
And
So
how
anyway.
often do you, in this sort of presentation, would you hear someone say, sometimes I have this feeling like right side rib cage, it's a little tender, or maybe sometimes if I press there, it actually upon palpation feels tender. Is that something that flags a fair amount
Yes,
with these people? Okay.
absolutely. Oh yeah, absolutely. Yeah, you got to think
I
of
would think
all of
so. Yeah,
that.
yeah. Okay.
Yeah, yeah, and then so I got to be careful then, just you know, uh, the care, I think, of, and if I'm a little concerned about, if I hear that, I'm a little concerned about putting something like a Chanca, which is, our little roto-rooter in there, then I might be stepping back and going like, how about we just hot, cold, hot, cold, hot, cold. Like, let's just start doing this, a little bit with those bile ducts, right? Instead of like roto-rootering them out, go a little bit more gently. And then if you can, move into the castor oil, maybe just for an hour. Like, go slow, because if you're super congested, it can be rough to move that stuff out. So, but yes, to your question, like, will that be one thing that I'm assessing? Absolutely. Absolutely. And I'll just say the other thing that I assess is intolerance to binders. So if you are like going through mold treatment or things like that, and you're putting binders in, and then you're like, they're horribly constipated for you, or you just get so much more reactive, that's another indicator to me. Reactivity to glutathione, because we're kind of, now we're kind of forcing more detoxification into a situation that can't be detoxified very well. So if we're throwing NAC and glutathione, it's like, I can't do that. There's a whole life going on in between both of those areas. Right, of like pushing things through and grabbing things out. And if we just don't have those bile flow, so I find that if we can open it up, we can get tolerance to those NACs, and we can get tolerant to those binders, and now we've got the river flowing. So anyway,
Okay.
it's a big deal for me. I,
That's
I
great.
work a lot there.
Yeah,
Yeah.
that's really helpful. Love it, love it, love it. HCL. So the risk factors we look for, not to say any of these are perfect, but they're all just suggestions, is age. If you're over 65, it's more common to have low HCL. If there's a history of anemia, and if there's any diagnosed autoimmune condition. Per the research literature, this puts you anywhere between, I think it's about 20 to, at the highest, 50% of people with those historical findings may have low HCL. So it doesn't mean you will. It means you may. And then you look, like you had said, when you eat protein, do you feel like it just sits in your gut, doesn't really move? Maybe there's burping, I think, is also potentially demonstrative of low HCL. Those are the things that we think about. How do you think about the warning signs for HCL?
Yeah, all of that, everything. Also, back to kind of the dysmotility aspect of things, and I'm not going to harp on the bile ducts again, but remember what HCl does. It's sort of this, that high acid is also sending signals to the rest of the body. It's sending signals to the bile duct to make more bile. It's sending, which then sends signal to the pancreas to make more pancreatic enzymes, right? It's kind of sending all of that, and sometimes, if we're, again, I'm going to come back to the dysmotility aspect of things, because most of my clients are constipated. I've got some diarrhea, but the majority, just like, things are not moving, especially in the small intestine, maybe large intestine. I think of, we've got two kind of areas of constipation. There's large intestine and small intestine, right? So somebody can have daily bowel movements and, think I'm not constipated, but if they're bloated and we've got a lot of, reactivity going on higher up in the small intestine, okay, we've got some level of congestion that needs to be opened up. And so I kind of think about, what is that hydrochloric acid kind of telling the body, right? So sometimes just adding in the HCl will kind of encourage the body to kind of make more of those things. So when I'm assessing, I am looking at that sense of, sometimes the belching, especially after high protein meals, certainly the food that's just kind of hanging out for longer periods of time. They notice that, and I'll assess the diet, like, oh, when you ate the oatmeal in the morning, that felt fine. When you ate the big, chicken whatever or the beef whatever or whatever, that's when you really start to notice things kind of hanging out a little bit more, right? So you can also kind of just like, look at the pattern within the diet to get a sense of whether you need it. Certainly look at the age, particularly, if we're working into our 70s. And then I also look at the stress aspect of things. How many stories have you heard? Like, what was going on at the time that all of this went down? Like 90% of the time, it was like, well, it was really crazy. I was going through a divorce and I was da-da-da. There's just like, started a new job and I hated my boss and da-da-da. It's like you can kind of, like all the things that kind of feed into that. Well, okay, so we also need to, how's life now? And if I don't know a lot of people who aren't stressed out right now, so it's like, what else do we need to be thinking about from that vagal limbic perspective that could be kind of keeping that, HCL under wraps? Maybe we're not producing enough. So anyway, I do use quite a bit of HCL, for those purposes, just to kind of, I poke around a lot. I'll say that. Like I like to kind of say like, well, what happens if we do this? What happens? It's like, oh, I put in the HCL and I either get horrible heartburn or I feel like, yeah, things are kind of moving. Okay, well, we can kind of assess from that. What happens if we do this? So I think we have to step back from like, well, you're old and stressed, so you need more HCL, and you have to think like, well, you're of advanced age and you are also stressed. What happens when we do that? What do we see? And then let the body let us know so that we can kind of go like, that's a piece. That's
Yes.
a piece. That's
Love
a piece.
it. Very,
Right.
very practical, right? And I'm
Yeah.
very much the same way where it's mostly hypothesis. And then what I care about the most is when the person reports back, are we moving the needle? And if we're not, we're going to move on and not think because HCL is compelling to you, we're just going to keep you on that forever. We need to see at least an inkling of benefit. And I'm assuming with HCL, you're noticing this because my experience has been people will notice usually within a week. Is it a fairly quick time to observe benefit from HCL? Okay.
Absolutely.
And that's
usually
another
a
thing that's so
day.
nice about these experiments. Yeah. It doesn't take a lot of time. Right. And just like
No.
for our audience, again, most of these things, not all, but so many of these experiments, they're not in months. You should know within a few weeks if it's helping you. And that's such an important part of the process where we like to check in roughly once per month, give someone a few homework assignments, check back in and evaluate. And then we keep what works and we get rid of what doesn't. And then we try to just keep the cadence going. Yeah. Yeah.
Most importantly, get rid of what doesn't. Right? Because man, if you keep layering in and layering in and layering in, and that one you put in didn't do anything. I ask people all the time when I see the laundry list,
Yes.
I'm like, and they still feel like crap. So I'm like, well, can we go through each of those things? And, maybe they can go like, yeah, definitely the magnesium. Yeah, that helps. Definitely the melatonin. Yeah, that helps. Definitely. Okay, great. Well, what about this? What about that? I've never seen anything from that. Okay. Well, not only are maybe we're just taking a lot of stuff that is unnecessary, but over time, those things can kind of build up and actually start to create more issues for you. They
Yeah.
can start to feed into the problem.
Yep.
Because if you don't need hydrochloric acid, and yet maybe initially it felt good, but then like I see this a lot too, like there might be this initial like, yeah, definitely need it. I absolutely need that. That felt great. But then you start kind of working on co-infection, SIBO, stress, all of that. Well, and then all of a sudden you're not feeling well anymore, or you're getting intestinal burning, or you're getting bloat or whatever. It's possible that, what you needed that thing for is no longer applicable because you've actually healed in many ways. And so we always have to be thinking about that. A, do you tolerate it? B, does it do anything for you? If it does, keep it there. If it doesn't, remove it and move on to the next thing. But always to remember that even things that have worked for you before may actually be turning on you now. And we might need to be thinking about that
Yeah.
as we move forward
Yeah,
as well.
less is more,
So,
right? I think we're on that same page. Less is more.
more.
And I get the perspective
Absolutely.
from the patient is, I would do anything to feel better. So I'm just going to keep it on board. But just remember, there's another side to that coin. There's a double edge to that sword in that things over time that you don't need, especially for taking a lot of supplements, even the cleanest supplements will have some excipients, some binders, and maybe even it's just enough of those can start to act as a trigger of your symptoms. So yeah, okay, same page, same page, same page. Love it. DAO enzymes. This is the enzyme that breaks down histamine. Curious your thoughts on this. The way we've been using this is we wait maybe a month or two in, because sometimes I see people react to it, and I think that's if they have a really sensitive GI lining. So we kind of think maybe phase 2. Let's start phase 1. Low histamine, probiotic, right? Whatever is indicated. Maybe they have overt signs of fungal overgrowth because they're carb intolerant, and we sort of help cue them in on that. Maybe they've been going too low FODMAP because they've read so much about SIBO, but they don't really seem like they have SIBO. It's instead Candida, but they've been eating a lot of white rice because they heard that white rice is better for SIBO. And so, okay, we want to start with this sort of like gut typing, focusing you, and then we'll reevaluate, do we need DAO? So that's our perspective. But, I'm sorry, let me take one step back to HCL. Most capsules are about 500 milligrams. Are you like, so I'm assuming you're starting at about 500 and then you're going to go up. We top out, I think, at about maybe 2,000 milligrams, 4-ish capsules. So that would
Per
actually
meal
be
or per
a little,
day?
per meal. I mean, not a lot of people need 4 capsules per meal. It usually seems like between 1 to 3 capsules per meal, people are going to notice something. But just to give people a sense, because there's that perspective about HCL, which is increase the dose until you feel burning and then back down. I think that's really misguided. I think it pushes people way too high. So what dose range are you typically clocking in at with HCL?
500 to 1,000 is typically where I am, because I know that you can take more. What I was seeing is that, way back when I was going like take it to the top and then take it down, and that's your dosage. You have people taking like 15 to 18.
Yeah, per meal, right? Yeah.
I'm like, okay, well, clearly there's a problem there, as far as like you don't have a lot of stomach acid. But what I was seeing is that it was really starting to add up in terms of just like intestinal agitation and inflammation over the course of time.
Sure.
And so, I try to kind of really keep it to that, like, again, my population, pretty sensitive. I try to keep it to that 500 to 1,000. Some might go a little bit more, but remember, we are taking it like 3 times a day, so that might add up to like 1,500 to 3,000 over the course of the day. I also, I do work a lot with bitters as well. So I'm also kind of like, what can we do to ask your body to make more hydrochloric acid? And I'm also kind of working from a nervous system perspective. And so at the same time, so instead of relying on one thing of like, oh, here's all your HCL to kind of do all the work, we also have to think about, again, all the reasons why you might need that HCL. And so maybe we just kind of keep it low for now, and then likely we're not going to need it at a certain point. Hopefully won't need it. Age, that could, who knows, but I keep it light. Yeah, I keep it light.
Yeah. And then with DAO, when do you use this? What dosages do you use? And what else? What other pearls do you want to share?
I have a very complicated relationship with DAO. So I first of all, I hate that it's so expensive. I really do. I keep my eye. I'm just going to say this up front. Like, it's $1 to $1.50 a pill, right? It's like, and I mean, how much money are people spending on all of it? On our services, on the labs, on the medications, on the everything, right? Like everything's out of pocket for people because what our population needs isn't found, typically where insurance is going to be covered, maybe, right? So it's like, people can go broke with all of this stuff. So I'm going to say, like, here, spend five to $10 a day on, taking DAO. That's a hard sell for some people. So I have a complicated. At the same time, we know that things like histamine intolerance, we know that a lot of just kind of, we know that when there's a level of intestinal inflammation, that you might get depleted in your diamine oxidase, and so we might need to kind of help you out there. And so removing foods from the diet can be helpful, right? Because it's going to reduce the intestinal inflammation, and maybe you can build a little bit more diamine oxidase from taking down the histamines. So so I'm always trying to kind of think, well, how could I help you to make more diamine oxidase? So I tend to kind of go in that direction a little bit more. How can we help to kind of, support the gut as much as we possibly can. So just so you know, I tend to kind of work a little bit more having gone through, DAO trials, because then when you kind of, let's add in the actual DAO itself, let's take all of the rest of the expense and all of that off of there. For me, it's like I don't know, 70-30 split. Like for 70%, they're like, I don't really notice any difference when I take it. Or I have to take 4 of them in order to notice the difference when I take it. And I cannot afford $12 a day to take this, right? So it's like, going back to the cost. So sometimes I just don't see the benefit from it. And then the other 30%, then it's like, great, okay, let's bring that in. Now, to your point, is it just too early in the process? Some of those patients will react to it. I'm going to say a lot of reactivity to DAO. Not a lot reactivity to it. I know some people do react to it, but more often than not, it's this like, I always ask them, is the DAO doing anything for you? And it's this like, I don't know. I don't know.
Yeah.
I haven't really noticed anything.
Similar,
So it's like,
similar
maybe
here. Yeah,
you too?
70-30
Yeah.
is about. I was jazzed about it initially, but and it makes so much sense. I think patients were probably putting a little bit of pressure on me, just sort of sharing, and I listen. And I, a couple years ago, was not too keen on it. Then we started trying it, and yeah, it didn't land. It does land for some, but I would say about 70-30, with the 30 being the responsive group, tracks with what I've seen.
Yeah. And that's great. Like, so because if that does work for you, then that does allow you to, do more, a little bit more from going out to dinner, especially, being able to go to people's homes and not worry about, is there a histamine in that? It does kind of help to kind of support that. And maybe maybe you'll just do more low histamine at home because it's too expensive, to do that every single time.
Yeah, I like that. Yep.
So it's a nice little supportive kind of thing. I rarely use it as sort of my baseline, like, all right, you got to get your DAO in. Unless we're just not getting anywhere. I just feel like there's other ways for us to help ourselves build DAO, other ways to help us build, enzymes. Like, what are the things that are deficient? What's the body telling us, and how do we get that back? So those are just sort of things. But yes, you can try the DAO and maybe it'll help. There's like ones made from legumes and one made from pork. Most of them are made from the pork, and some people can't tolerate that. If you have alpha-gal or whatever, you just don't like that idea. You can get them made from beans. There's another, some people will find a little bit more benefit from actually taking like the actual kidney itself, like some of the more, the ground up kidney. Yeah, exactly. Like some people actually find that to be better tolerated, and B, like more helpful. The theory there is that, we produce DAO in the kidney and in the intestinal lining. And so if you're taking in from an animal and you're taking in all of their DAO, perhaps that's a better match in that sense. So,
sure. Yeah.
Anyway.
Okay.
There's lots of different ways to kind of play with it. I wouldn't discourage it. I don't know. It hasn't become one of my go-tos.
Yeah. No, I mean, it's good when someone will say that some therapeutics aren't very helpful, because that at least tells me that they're scrupulous and they're always questioning. Like I've said before, every once in a while I have this mentality of like, is this all BS? And I'm kind of ready to just like gut our clinical model, because I want to put pressure on it to make sure that what we're using is really delivering for people. And I think that impetus is good. I've often shared this caricature of a colleague who everything works awesome. All the superlatives are very strong. Oh, we're seeing tons of great results. If someone says that a lot, I'm thinking that they're not really questioning, because there's not many things that work very well for all people. That's like, I can think of like 3 things maybe in our arsenal that I can make that claim for. And then there's many that it's like 50-50, like sometimes it hits, sometimes it doesn't. So anyway, just I guess.
I feel the exact same way. I'm more on the same page on all of this. This is why, like, I kind of zeroed on the bile doctor, the motility issue. For me, it's like, that's the area where a lot of people have issues. So that's the area where I spend the most of my time. because I'm like, I get, look, if this works for you, it can be a huge difference in terms of, because I'm all about trying to get people to get their food in, right? It's like people come to me to expand their diet. I can't just give them more food. I can't just say like, well, here, try this, see what happens, I have to figure out why they're not tolerating it. So when you kind of find those things that you go like, oh, I think this is a big piece of this, then wow, maybe we don't need the DAO, maybe we don't need the enzyme, maybe we don't need a lot of those things that we kind of base kind of try to kind of stabilize things. Maybe we don't need those things quite as much. If you can kind of go to those things where you go like, okay, I think if we can open this up, we're going to be good.
Yeah. Love it. Love it.
Yeah.
Fiber enzymes. So for the SIBO crowd, right, the people that notice fiber, or just your general IBS, fibers can be an issue. What enzymes here do you like, and what are sort of the ways you sort of work people through when to use these, what product and what dosages?
So it kind of, again, depends upon the person and what I'm hearing. Is it a FODMAP thing, or is it just like all fiber thing? I think what's important to do is step back, is like most of the fibers, digesting enzymes are coming from the bacteria in our gut. So, so that's a key piece. So if we have SIBO and, we're digesting all of those FODMAPs and fibers and things like that, and we're kind of getting the effect of the bacteria in there, that's going to be more problematic. Sometimes if we put those enzymes in there to help things break down, kind of takes away a little bit of the bacterial fermentation. So we get less of that byproduct of the bacterial fermentation, so that we're able to kind of maybe help ourselves break things down a little bit more easily. Therefore, we get less fermentation from the bacteria, and we're able to kind of process that a little bit better. We can say this, people have phenolic compound issues, so like salicylates and things like that. Xylanase is an enzyme that helps us to break that down. So sometimes doing more digestive enzymes that help to just target our phenolic compounds can be really beneficial, and helping people to tolerate more salicylates in the diet. So we kind of have to, it kind of depends, right? So I'm just kind of like assessing, like, is this a FODMAP thing? Is this a salicylate thing? Sometimes it's just all vegetables, and we just have to kind of help to support that. There's one, let's see, what do I use? I'm thinking like, there's one actually from Enzymedica called Veggie that I actually like, and it's relatively inexpensive. It's like $19, right? Versus like FODzymes or FODmates or whatever that are like $50, $60, $70. Again, I'm always keeping my eye on the bottom line. Always. And I don't see the difference between them. So, um, what I like about the Veggie, I don't believe it has lactase in there. And so some people, lactase can be agitating to them if they are already producing enough. But you might need additional lactase if that is a problem. Also, most of the clients are off of dairy, so they don't necessarily need a lot of lactase coming through. But I actually like Veggie just fine. Inexpensive, and I find that at least gives me a sense of whether that's going to help at all, right? Whether that's going to be a thing for you. Have used like the FODzymes and the FODmates, things like that in the past, and that's a little bit more specific to the FODMAP. And again, some people love that and do just great with that as well. So, and then you are going to find a lot of those fiber digesting enzymes in any kind of digestive enzyme. So if you are already taking a digestive enzyme that has a lot of those cellulase and hemicellulase and alpha galactosidase and all of those kind of things that are in there, xylanase, that are not pancreatic enzymes or brush border enzymes or HCL, all of those things in there, you are getting some support there. So if you're already taking something like that and you're tolerating the whole thing, you are getting some support there. But if you don't tolerate other enzymes, and I just hear that the fibers are maybe more problematic, then I might kind of layer in some of those more fiber digesting enzymes. But I think Veggie is usually my first thing.
What if someone you suspect has fungal overgrowth, they've exhibited starch and sugar intolerance? Is there an enzyme way that you found to be able to help with that?
It's always that question of like fermentation by the actual fungus itself or the yeast itself. Is that the problem? In which case, no, right? No. It's a matter of just tolerance at that point. If it's the inflammatory aspect that's managing, like the brush border enzymes, right? So we also haven't even talked about those guys, right? So we've got that liner, the enterocytes that line our digestive tract also produce different enzymes. They're called brush border enzymes. And those are primarily, we've got a few proteases in there, but they're primarily about like finishing carbohydrate digestion. So if we are finding that when I take in a carbohydrate, I'm getting all this bloat and all this gas. Okay, yeah, that could be from fermentation, from the SIBO or from the SIFO or the fungal, whatever's going on in there. But it could also just be because there's so much inflammation going on in the gut that maybe you're not producing adequate amounts of brush border enzymes that are necessary to complete that digestion. So that's where I might kind of just do like, well, what happens if we just do those brush border enzymes for you? And Claire Labs has one, the Enzymes, right, that you can kind of just do. And again, some of the larger ones will include all of that, but I might kind of layer that in as well as something to consider. I mean, certainly amylase. We do see, there's a Nest Labs. I don't know if you work with them at all. They're a supplement company, and they do individual enzymes. So it's like you can get lipase from them, or the HCL or the protease, or you can get the amylase from them. And so sometimes if I am kind of feeling like this is really just I don't want to give them all the enzymes, I just want to really kind of target that carbohydrate thing, then I might just try getting amylase from Ness and then give that to them and see how that goes. So yeah, so it's that question: is it fermentation, or is it something about the inflammation that's feeding into the deficiency? And can we help that?
Okay.
Yeah.
Shifting gears to adhesions, adhesions and endometriosis, things that are sort of stepping on the garden hose that is the intestinal tract. Certainly, I was really impressed with that meta-analysis finding that abdominal massage can help with constipation. And the way I think about this is it can be one of two things. It could be an adhesion, sort of occluding the hose, or it could be the highway. The hose has a lot of really tight turns where just anatomically where food tends to get stuck. And so in either case, some massage can help push the food matter past this inflection point. And for some people really lands, again, like we've been talking about, they'll know inside of a week usually. So the beauty of these things is you don't have to do it for 6 months before we can appraise if it's helpful or not. What do you think about with adhesion? Sort of same question in terms of anything that you see historically, and then what do you recommend for people?
Well, again, looking at the history, of like, especially people who have had like C-sections, that's look at that. And also, is that when, or sometime after that, is that when they started to notice more digestive issues start to occur? Because usually this is all going, the food intolerance, but also the digestive issue. So, I recently, someone who, everything started after multiple C-sections, right? So we tested for SIBO, and that was positive, but I'm like, boy, if the adhesions, I get that you're positive, but do I really want to treat that right now? Because if those adhesions are getting in the way, if that's the issue, right? If they're just like hanging on and creating these little issues, and we're collecting bacteria because of that in the gut, well, I could throw as many probiotic or antibiotics or probiotics or whatever at you. We're not going to get anywhere. It's just going to come right back because we still have that issue, right? So, we've got SIBO, and yes, we have terrible food intolerance, FODMAP intolerance, all of that, because there's so much fermentation and there's so much dysmotility, right? I ate the food, I've got SIBO, I'm getting more fermentation, that's creating visceral hypersensitivity, leaky gut, I'm getting more joint pain, back pain, right? All this stuff was going on. And I said, I think you need visceral manipulation, a visceral massage to really assess for that situation, because I can come in and try all of these things that are in all of our toolboxes, but if that's the issue, nothing is going to resolve in this situation. We're just going to be right back to step one. So she starts doing visceral manipulation. And you're right. Within one treatment, we start to see a shift. No, something's different. Okay, you keep doing that. Now we can come in and start reducing some of the bacteria. Now we can kind of like, let's go low FODMAP just to reduce some of the fermentation happening. But you keep doing that. And as she's opening this up more and more and more, look, now, things are flowing. Now her motility is back. Now, hey, look, the SIBO is gone. Oh, look, you don't have the food intolerances anymore. And hey, look, your body feels a lot better. You have less inflammation, right? So to all of that, you have to look at the history. You have to look at, and is there dysmotility? I think those are the two things that I would look at. Endometriosis, that's a tough one, man. That is, and I'm seeing more and more endometriosis. And, the docs are kind of like, look, can't really do much about it. Here's the pill. We're going to wait until you go into menopause, maybe. But, that tissue, not only is it, secreting, histamine, which is creating issues, but it's also it's also potentially feeding into a level of dysmotility. It's a very difficult thing to diagnose without going in and looking around. So that's a tough one, but I'm seeing a lot more of that. I don't know why.
I think we should
what,
double click on that one in a part 2, because I want to talk about how I'm assuming you're referring for someone for an evaluation, which are hard to find, but a good therapist who can assess for endometriosis, I think, is worth his or her weight in gold. So we'll talk more about that, dysmotility, sinus inflammation, because I know this is something that we're both seeing some of, limbic system, and then maybe a little bit on testing. So, I mean, just so much here. I feel like we have another hour easily to do a part 2. Before we break, though, where can people track you down? And then any closing thoughts you want to leave people with before we, have our part 2 to come here.
Think
Hopefully,
about
not too long. Yeah.
Exactly. You can find me at foodlogic.org. That's my website. I am a private practitioner, so I do see clients one-on-one. I'm on Instagram at Food Logic Nutrition. I'm not a great poster, but I will be getting better at that. But yeah, final thoughts. I think the most important thing in all of this that I think we've touched on today is really tapping into your own intuition. Not just kind of listening to what everybody's telling you to do, but also just really thinking about your own individuality within all of this. What works for you? What doesn't work for you specifically? I think that's the most important thing that you can take away from our conversation today. Because as you see, there's about 900 things you can do in relation to diet and supplementation and all of these things we're talking about. And really, it's just a matter of kind of like testing things out one by one. And really, since it is a little overwhelming, even as a practitioner, really seeking out somebody who understands this way of practicing and who can really guide you along the way, because it is challenging. It is challenging. So the more support you can get to help you find your way, the better.
Well said. Well, Heidi, sorry that I cut this a little bit short, but
That's okay.
I'm so glad that we had a chance to catch up. It's been longer than I think it should have been. So glad that we chatted. We'll definitely do a part 2. And just thank you for your work, because I think it really is important that nutritionists and those who are focused on nutrition have this really broad scope of what they're looking at and are putting the patient experience and perspective and response first. So again, kindred spirit, really appreciate you. And thanks again for coming on.
Yeah, thanks so much. You take care.